What precision do imaging tests offer for bone cancer diagnosis? Imagine trying to find a tiny needle in a large haystack. That's similar to detecting early bone cancer. Imaging tests are like specialized tools that help doctors locate and understand these hidden threats. They provide vital clues about where the tumor is, how big it is, and whether it has spread. Each imaging method has its strengths and limitations, so doctors often use a combination to get the clearest picture. X-ray imaging is usually the first step because it is quick, affordable, and widely available. It can reveal changes in bone density and structural damage caused by tumors. However, X-rays may miss small or early-stage cancers because they lack the detail needed to see tiny tumors. They are great for initial assessments but often need to be supplemented with more detailed scans. Magnetic resonance imaging, or MRI, offers a much higher level of detail. It uses strong magnets and radio waves to create detailed images of both bone and surrounding soft tissues. MRI is especially helpful for determining the size of a tumor and whether it has invaded nearby tissues. This makes it a key tool when precise information about soft tissue involvement is needed. Its ability to differentiate between healthy tissue and cancerous tissue makes it invaluable in planning treatment. Computed tomography scans, or CORT scans, provide cross-sectional images of the body. They are particularly useful for visualizing complex bone structures and detecting tumors in areas that X-rays might miss. CORT scans are also often used to guide biopsies, which are necessary for confirming a diagnosis. When protocols are optimized, CORT scans have high sensitivity for detecting bone tumors, making them a reliable choice for detailed imaging. Bone scans, also called scintigraphy, involve injecting a small amount of radioactive material into the bloodstream. This tracer travels to areas of high bone activity, which often include cancerous growths. Bone scans are very sensitive and can detect both primary bone tumors and metastases, or spread of cancer to other bones. However, because they are not specific, additional tests are needed to confirm whether the areas of increased activity are indeed cancer. Positron emission tomography, or PET scans, use a radioactive sugar that accumulates in rapidly growing cells, like cancer cells. PET scans are excellent for showing the spread of cancer throughout the body and assessing how well treatment is working. When combined with CORT scans in PET/CORT imaging, they provide both functional information about cancer activity and detailed anatomical images, giving a comprehensive view. In terms of accuracy, MRI generally offers the highest precision for detecting spinal metastases, which can occur if bone cancer spreads to the spine. CORT scans are also highly sensitive, especially when specific protocols are used to improve detection. Emerging technologies like machine learning and radiomics are being studied to further enhance diagnostic accuracy, but they are still being validated for routine clinical use. Ultimately, the choice of imaging depends on the individual case, including the location of the suspected tumor and the need to assess spread. Often, doctors will use a combination of these tests to get the most complete understanding of the situation. Consulting with healthcare professionals is essential, as they can interpret these images in the context of symptoms and other tests. Remember, each person's experience with bone cancer is unique, and diagnosis involves a careful, personalized approach based on the best available scientific evidence.